ever get insurance, it would cost too much. They don't insure for this here. You'd have huge bills. And so they took the doctor's advice, and so they moved to Canada. They were doing just fine. But what many countries have experienced is that if you do not budget your system appropriately, you may end up with a shortage of specialty surgeons, which would create a wait. Emergency cases.
Now, that is something that H.R. 676 does address, that you address in that, is the possibility of the upcoming shortages of specialists, shortages of doctors that may be upcoming.
Well, that's one of the things. That's why we have doctors working with us on this. The Physicians for National Health Plan, PHNP, are doctors, professional health caregivers, scholars, who have all come together and help us go over this bill. Every year we look at it and try to make it a little bit better, or we improve it. And one of the things is, we know we have to create more opportunities for doctors to practice, and we have to keep them in, to get them to go into family medicine and primary care, because many doctors are so bummed out by the administrative costs, and the reimbursement rates are so low for some things that the doctors end up losing money treating patients under Medicaid plans. And so what we're doing is creating a system where the government is not involved. The single payer in the insurance will not be government workers. It will be an insurance corporation.
Right, and the doctors
and many
separate.
of the people that are already in the plan will be needed to administer this plan for all of our citizens in the country. So they will be working, and then for those who there might not be opportunities, we have retraining programs. We have extended compensation for 2 years for those who are not employed. But we want a full employment plan. We're not doing this to put people out of work. It's our calculation. We're going to need more people to handle the paperwork.
And I think Radia did address that. And doesn't that actually, though, grow government even more then?
Well, it doesn't grow the government because well, it'll create more doctors. That doesn't grow the government. We need nurses very badly. That doesn't grow the
So it's growing the healthcare economy, such as where it's needed, but not the government
But it isn't the government. See, the government finances.
I keep thinking of all those poor insurance adjusters who are going to have
some of your former colleagues. Right.
And but now, okay, so you have H.R. 676. It has now been reintroduced now into the 110th Congress.
It is.
And it has 85 co-sponsors.
Exactly.
And I noticed on those co-sponsors that it has nothing, it has no Republicans on there. Have you reached out to congresspeople like Joanne Emerson? Republicans, I mean, the more of the moderate.
Mm-hmm. Well, we're talking to everybody, but I must say at this stage, we've been working with... well,
in the 109th Congress, how many co-signers did you have?
We had less than what we have now. It was in the 70s.
Well, 69,
60s or 70s,
I think, something like that.
We're very encouraged because more and more people are coming into the plan, 676, and we plan to have 100 co-sponsors, but we're still looking for Republicans, and Republicans seem to have a greater difficulty in coming around to any kind of universal plan. Listen to the Republican candidates for president. They don't talk about health insurance.
I don't think health insurance
As a
is an
matter of
issue.
fact, was it the president that said you can go to emergency rooms? There are now hospitals that are violating the law that will not let people come into emergency rooms if they do not have insurance.
Well, even in the poor districts,
That's sad.
they have hospitals actually shutting down now. Community
right.
hospitals shutting down. So
And
actually going to the emergency room may not be an option for a lot of people.
that's what happened in Washington. They just closed the public hospital in Washington 1 or 2 years ago. I remember because I was in the great struggle to try to keep it open. They said, well, we'll send, don't worry, Congressman, we'll send all these folks to hospitals in the suburbs. It'll be okay. Well, I don't think so. They're not waiting for people. They never tried to get people to come out to their hospitals before, and I didn't think that they were going to do it now. And it's creating a huge problem. And this is why this is a...
Well, and we know it's a problem. And one other thing, because we're just about ready to wrap up, is you have the sponsors, 85 co-sponsors. What if people want to support this, what could they do? I mean, is there something that the average American out there that may watch this decide, what can I do?
Yes, all they have to do is call our office or any of the members or their own congressman if they're one of the 85 on it. And we have people coming out for town hall meetings. We have a number of people that make beautiful PowerPoint presentations to explain what this is. We have lots of cities that have endorsed it.
Including unions also. I think the SEIU has endorsed it.
The international unions, UAW, the United Steelworkers were one of the first to come on. I have a page full of union sponsors. They're
right.
behind it 100%. But
which we're just about out of time now.
Checking our web page.
But go to your website and look
Conyers.
up House to do different things throughout town hall meetings with and calling up their congresspeople. And Radia, just we have a few seconds left.
Yeah, and actually on this topic of emergency rooms, the Vinetta Foundation is doing some work in Baltimore City with Peter Bourne, who was Jimmy Carter's campaign manager and his health czar, and we're trying to introduce a Cuban-inspired model of healthcare to keep the people out of the emergency room, put more emphasis on preventive medicine. So we're definitely in line with
HR 676.
Yeah, HR 676.
Well, I want to thank everyone for joining us here today on American Dream. I'd also like to thank you, Congressman Conyers. It's an honor to have you on my show. And Radia, thank you so much and I'm hoping both of you will be back. And I hope that a lot of questions got answered here today on American Dream about healthcare here in America, and hopefully maybe some answers and solutions to where we are at.
Can we invite